Welcome to our Alumni Nutrition Talks series, a celebration of 40 years of training nutritional therapists. I'm Heather Rosa, the Dean, and I hope you enjoy this presentation.
Hello, I'm Dian Shepperson, and I'm here for a webinar to celebrate the 40th anniversary of the Institute for Optimum Nutrition. I'm going to talk about endometriosis. So I had endometriosis, which is why I got into this in the first place. The pain was extreme. I had lots of blood sloshing around my abdomen. I had cysts the size of grapefruits on my ovaries. So it was horrible. So endometriosis, what do we know about it? We know that it happens when the womb lining or material similar to the womb lining somehow transfers, we think through the fallopian tubes, but it may go through the bloodstream, and it starts to grow on other organs in the body. It takes 4 hours to seed itself and implant. It can be shallow or it can be deep infiltrating. You can have lumps of it, or you may just have little tiny splatters of it on the epithelial tissue in the abdomen. It can be on the womb, the ovaries, on the outside. It can be on the bowel and bladder. And of course, this tissue responds to hormones in the body. So it can bleed internally and cause a lot of irritation, inflammation, and pain. Now, what we know is that it affects 1 in 10 women on planet Earth. The estimate is that there are 176 million women diagnosed with endometriosis, around 2 million of them in this country. I have seen women where it's literally from the age of 9. I had an 8-year-old girl started periods. Mum brought her to me. The gynecologist told her she'd be better when she had a baby. So we managed to get her to a clinic in Harley Street. There was one gynecologist doing a specialist clinic for teenage girls because it's very difficult to treat. You don't really want to do laparoscopies. And the oldest woman I saw was 72. She'd had endometriosis, had a hysterectomy and ovaries out, took HRT, and the estrogen triggered the endometriosis to come back. So menopause doesn't always stop symptoms, but it's supposed to die down then. Period pain, well, it's like having acid inside you. It can be extreme. Deep dragging pain, killer cramps where your whole womb's in a knot and your bowels are affected as well. And you can have abnormal heavy bleeding. You can have nausea and vomiting or fainting. And at that point, please get yourself to A&E because you need help. And some doctors don't understand the implication. The problem is that we all present to our GP with pains in different places. My pain was left-hand side. Some people it's right-hand side. Some people it's in their back. Some people it's at the front. Some people it's in their diaphragm, in their shoulders. They get shoulder pain. I've treated 21 women with endometriosis in their lung where they coughed up blood. So it manifests in so many ways. The first case we know about was a woman who bled from her eye when she had a period. And cold sweat and your teeth chattering is like your body's going into shock. So it is can be extreme, but it's a conundrum because many women don't have any pain at all. They opened one woman up and she had a lump of endometriosis the size of a 5-month-old fetus, but had no period pain whatsoever. So this is why it's a conundrum. An ultrasound scan may show if there are implants and small lumps, but to see it properly, you need an MRI scan before a laparoscopy, where they may try and remove what they can see. And when they're doing a laparoscopy, you need a biopsy because there is such a thing as occult endometriosis, which can only be seen on a slide under a microscope. So you've got a poor quality of life because you want to go out with your friends, but that evening you're doubled over in pain and can't go. You're exhausted at work, you get home and flop. So it's very difficult disease to treat. Conventional medications, apart from a laparoscopy using laser or microsurgery to remove it, you can have laparotomies if it's extreme. You can take the oral contraceptive pill, which makes the pituitary imagine you're in pregnancy mode. So it switches off the endometriosis. Or you may be given GnRH analogs, which make the body go into menopause-like state. Dianogest, a progestogen, is also given. At Edinburgh, they're looking at dichloroacetal. In Japan, they found that women with endo have a certain bacterial infection. So they've been using an antibiotic. They're doing trials on chlorophenicol, an antibiotic. So there are lots of different ways of looking at what's happening and trying to help. Now, endometriosis happens when our body's in a state of estrogen dominance. We have estrogen produced by the ovary. It's produced by body fat cells, the adrenal glands as well. And progesterone, natural progesterone, is made in the ovary. After the egg is released from the follicle, it comes out and is hoovered up by the fallopian tube. And then the follicle closes over and becomes the corpus luteum, the golden body, which is producing golden oil, which has progesterone in it, that will maintain the pregnancy until week 12, when the placenta can take over. And the placental material is coming, we've discovered, from the sperm. So partners, husbands, sperm donors all need to have healthy sperm. Now, because estrogen's high, hormones balance one another. Because estrogen's high, it can put down thyroxine, and it can also reduce progesterone. It's what's called progesterone resistance is seen. So hormones in your body, the estrogen and progesterone, are made from good oils. So trying to eat good oils, which we'll come on to later, is crucial. If you are having early miscarriages, you need certain tests. Celiac disease can cause the problem of sub-fertility in men and women, and hypothyroid can upset fertility. And they actually use autoantibodies to the thyroid tests to predict if you're having an early miscarriage. The other problem, as I mentioned, is celiac disease. This is the gluten, the protein containing gliadin in a lot of cereals, wheat, rye, etc., barley. That can damage people. This is not an allergy. It is not an intolerance. It is a genetic trait. and it can damage your villi in your small intestine and wipe them out so that the area for absorbing nutrients is much, much smaller. And it can happen, as I said, in men and women. There are now 33 research papers around the world looking and linking gluten damage in the gut to damaged epithelial tissue. So we have to watch this space. I mentioned the oral contraceptive pill. That's taken by about 3.5 million women in Britain. As I said, the hormone in the pill makes the pituitary gland go in, which is behind your nose, the size of a green pea, switch into pregnancy mode to hopefully dry up the endometriotic implants. I'm seeing 22-year-olds who've been on the pill for 10 years continuously. And the one thing we do know is that the pill can make the gut membrane more permeable and reduces levels of the friendly gut flora in the microbiome. And it also depletes various nutrients like vitamin A, B1, B6, B2, B12, vitamin C, vitamin E, magnesium, zinc, selenium, copper, calcium, and CoQ10. And some of the contraceptive company pill makers in America, like Yasmin, have added a multivitamin to the pill to counteract the loss. And some users do report depression, which would be happening if your B vitamin levels are not normal. And your good gut flora is making those as well. So the microbiome, we are not what we think we are. We are symbionts. You scratch my back, I'll scratch yours. We are a person with a lot of genes, but our gut flora in the small intestine, about the weight of 2 bags of sugar, is producing B vitamins and vitamin K to keep us healthy. The B vitamins are used by liver enzymes to help break down the bad circulating estrogen, estradiol to estriol, which can be bound to fiber and excreted because we don't want bad estrogens hanging around. And the vitamin K helps blood. Now, the problem is this bacteria, there's more of it, more genes in that than there is in us. So we need to keep it healthy. And when it is healthy, apart from producing the B-vits and vitamin K, it's producing 80% of our immunoglobulins, which boost your immune system as well as supporting digestion and also helps your nervous system. So keeping your gut flora healthy is crucial. It is the largest immune organ in the body. So if you're having digestion problems, find a low histamine probiotic to take. That may support you. We then, of course, apart from estrogens made in our body and phytoestrogens normally occurring in food, there are xenoestrogens, Xeno, xenoestrogens, and they're in plastics and they're in pesticides. The dioxins, the phthalates, the PCBs, they're endocrine disruptors. They jiggle around our normal hormone balance and upset it. And they can damage the fetus, the newborns, women with endo, the sperm, the ova. So we need to be aware of our environment and try to keep it as clean as we can. It's very difficult because we're all in this boat together. But if you're aware of having lots of plastic things around you, then you can reduce the load, can't you? The other thing is dietary modifications. Omega-3 fatty acids reduce the impact of dioxins on progesterone receptor expression. So when they're eaten, they're possibly in our food, they may be in our water, bottled water, but tap water comes through plastic pipes as well. They can reduce fertility. But Michael Johnson at MRC, the Medical Research Council, has found that fish oils, the omega-3 fish oils, and nicotinamide, vitamin B3, help to remove the chemicals via the liver. So that may be helpful. Exercise, we all need gentle, moderate exercise. Even if you're in pain, you can do a short shoe shuffle, you can walk, you can do yoga, Tai Chi, Qigong, swimming, hydrotherapy. When I told my doctor one of my Swiss patients was being given hydrotherapy in Switzerland by the medical profession, he laughed. So I just took myself off to the swimming pool and walked and did arm and leg exercises. Natural daylight is crucial. You need 20 minutes of natural daylight on the retina of your eye in order for the pituitary here to absorb enough zinc to send the right hormonal message to your ovary. So during winter, when we're trapped indoors, going to work in the dark, coming home in the dark, stick your brolly up and go and walk round the block at work. You also need fresh air and water. So water filters or HEPA filters to clear the air. And there are various studies. There is Parazzini, who investigated nutrition in 500 patients with confirmed laparoscopic endometriosis, matched with 500 non-endo patients. And a significant difference was seen between the two groups. The women who ate high levels of ham and red meat with endometriosis had worse symptoms. The women without endo were eating high levels of fruit and veg. So more fruit and veg, semi-vegetarian. Stacy Mismer at Harvard, she looked at the nurses' study, and what she found is that the women who were eating higher levels of omega-3, cis natural fatty acids from oily fish, walnuts, linseed oil, and I've lost the word, but the algae oil, they had 22% lower levels of endometriosis. And the women who were eating high levels of seed trans fatty acids and oils, they had a 48% higher risk of endometriosis. The study also looked at the Mediterranean diet, which had a significant impact on endometriosis. When people were eating natural oils from nuts and seeds and olive oil, their endometriosis inflammation and pain was much less, like with the celiac disease, when people were staying off gluten. It may just be gluten sensitivity. Goats and sheep's dairy, A2 dairy, has L-proline in, which is an anti-inflammatory amino acid. So if you find you're bloating or getting more pain with cow's dairy, try some goats and sheep's. Also, I know it's very, very expensive, but if you have a bottle of extra virgin olive oil and just have 2 teaspoons a day mixed with 2 teaspoons of lemon juice on a little green leafy salad, that may well help you, because the shape of the olive oil isomer is the same as a non-steroidal anti-inflammatory like ibuprofen. So we have seen from research that also has a very good anti-inflammatory effect. The foods which help you reduce inflammation are all the berries, the proanthocyanidins, blue, black, red berries, flax seeds, omega-3 foods, the oily fish, the walnuts, 3 walnuts a day, garlic, herrings, kippers, salmon, sardines, mackerel. So a salad, whatever, or with fish, with vegetables, red onions, ginger and turmeric. I never start cooking anything without sauteing an onion and using a level teaspoon of ginger, level teaspoon of turmeric. Ginger helps calm the gut. To support your gut flora, you need things like avocado, coconut cream, flaxseed, sauerkraut, chicory, Jerusalem artichokes, fresh vegetable juices, blueberries, as we've said, cucumber, tomatoes, and kefir or yogurt. If you're thinking of trying supplements, then you can try and find a good quality multivitamin, yeast-free multivitamin, an omega-3 fish oil or linseed oil or algae oil, a low histamine probiotic. And if you're getting lots of cramps with the uterus or bowel, then a magnesium might support you. Find a good private health food shop with someone in it and talk to them about what the quality is like of the different ones. Now, I've worked with ASRM, which is American Society of Reproductive Medicine, and the World Endometriosis Society and ESHRA, and they've actually produced a book on endometriosis, and they're now saying that existing data supports the claims that nutrition counseling should be an important component of multimodal therapy in patients with endometriosis. So the role of nutrition in women at risk for endometriosis should be included in published treatment guidelines. And we've actually done this now in the treatment guidelines for ASRM, ESHRA, WES, and various countries. It is now listed in guidelines for treatment that women should see nutritionists. And I can remember when I was really ill, and I had some tapes from Bob Griswold of Edina, Minnesota. And the health tape was wonderful because you're lying there in agony and it's trying to relax you. And it says, stop hating the part of your body that's letting you down, but rather look upon it as a sick little child and love it better. We need to be aware, not anxious. We need to buy good food, but we've all got a finite amount of money. And you can only do with it what you have. So instead of having chocolate bars, buns, biscuits, cakes, you could have carrot and celery sticks, dip them into hummus. You could have a palm full of nuts with your 2 or 3 walnuts. You can have apples, pears, bananas, peaches. You need to reduce the chocolate, the buns, the crisps. Perhaps you just have the odd thing on a Saturday or Sunday. You can melt plain chocolate and dip berries into it, or banana slices. 2 teaspoons of lemon juice, 2 teaspoons of olive oil every day, and a little bowl of salady green leaves with some chopped herbs just before your evening meal, while you're waiting for it to cook. You can make vegetable soup with a carrot, a parsnip, an onion, a potato, some celery, some mushrooms, throw some spinach in, or you can put some split peas or lentils or barley in to give you protein. Michael Pullin at Berkeley University says, eat food, not too much, mostly plants. And the one I love the most is if your grandmother didn't cook with it or eat it, and if you can't pronounce it, don't eat it. There's a lot of talk now about ultra-processed foods, which are chemical concoctions made in a laboratory with substances that we've not taken into our body for long. and they're mixed together in a cocktail. So try where possible to cook from fresh, seasonal vegetables. At lunch, have a rule: 1 green, 1 red veg, some carrots, some broccoli. At dinner, supper, high tea, you have cheese and biscuits, but you have a spring onion and you have some tomatoes or grated carrot. This body has to last you for 100 years. You've seen the Queen, you've seen David Attenborough. They have been healthy to their old age. So we need to look after our bodies, choose to be healthy, choose to eat well. And if you're trying to get pregnant, if it's fertility, the food you eat builds the organs your baby's body is going to make while it's within the womb. You need a healthy egg, a healthy sperm, about 120 days to keep those healthy before they meet in the fallopian tubes. So 2 or 3 months before you're going to fall pregnant, start eating well, because this healthy baby has got to live to 100. That's what we're aiming for. We don't want poorly babies. The fertility of the earth, as we've seen on the news this morning, is beginning to fall. Once it falls past a certain point, it affects the economy of countries. We need healthy mothers, healthy babies to keep everybody as healthy as we can, really. So do your best. Just choose your food carefully. Be sensible. It's not being funny. It's wanting people to be as healthy as they can be for as long as they can be. So I will say good luck, and I hope that you have enjoyed this.
If you enjoyed this presentation, then click on the link in the description to subscribe to our Nutrition Talks email list. And don't forget to click the like button and subscribe.